As a doctor, I especially urge everyone over 50 to watch it. Today, you'll learn how breathing strengthens blood vessels and why this can help relieve varicose vein symptoms, how the gut is involved in the development of venous insufficiency, and which remedies can help get rid of spider veins. Watch until the end, and I'll show you effective exercises that can help you get rid of them. And before we begin, I want to say that unfortunately, 70% of my viewers watch my videos without subscribing. Because of this, YouTube thinks my videos aren't useful. So if you really find this video helpful, please make sure to subscribe. And in return, I promise to share even more useful information. Let me tell you how to determine the stage of varicose veins. If you have any problems with the veins in your legs, this information will help you figure things out. Take a look at this picture. It shows all the stages of varicose disease, from 0 to 6. Now let's figure out how to understand which stage you're at, for example, and at what point you can help yourself on your own. Here's a brief description of each stage. There's a stage called stage 0. Why? Because on the outside, everything looks normal. No visible veins, no swelling, but the person already feels heaviness in their legs, fatigue, maybe a slight tingling sensation. These are the first warning signs. If you don't do anything, after a while, the first stage develops. At this stage, spider veins, or a fine network of veins, appear. You might start to feel heat, burning, or swelling by the evening. So at this point, external symptoms are already starting to show. Again, some time passes, the person still does nothing, and they move on to stage 2. At this stage, varicose veins and nodules become clearly visible. The symptoms get worse. Night cramps appear, and there may be pain and fatigue in the legs. 3. This is already a more serious stage. There is constant swelling, especially in the evenings. The legs feel heavy and buzzing, dense patches of skin appear, and blood flow is severely impaired. Stage 4. The skin becomes dark and dry. At this stage, inflammation and even eczema can develop. Microcirculation is already affected, and the skin suffers as well. And at the 5th stage, skin changes are clearly visible, trophic ulcers appear, which may heal in some areas and reappear in others. And then there's the 6th stage. It's best not to reach this stage at all. These are active, non-healing ulcers. This is a very serious condition and requires immediate treatment. If you are at stage 0, 1, or 2, be sure to watch this video until the end. I'll show you which exercises and measures actually help. But if you notice signs of stage 3 or higher, go see a phlebologist immediately and get a vein ultrasound. You can't afford to wait even a minute longer. At this point, you need full medical treatment. So what should you do if, for example, you have stage 1 or 2? Understand that your breathing affects varicose veins. Yes, you've probably heard that varicose veins are all about the legs. But in reality, it starts with your breathing. Yes, with something as simple and basic as inhaling and exhaling. I'm not just saying this for no reason. There are studies that have shown that impaired diaphragmatic breathing is directly linked to congestion in the veins of the lower limbs. Let's break it down. When you breathe deeply with your belly, not your chest, you activate your own pump that helps blood move upward. This pump is called the diaphragm. It's actually a very powerful muscle located between the sternum and the abdominal cavity. And with every breath in, it starts to press on the abdominal organs, helping venous blood move upward against gravity, especially from the lower part of the body, the hips, pelvis, and calves. But if you breathe shallowly, for example, only with your chest, or if you're often stressed, the diaphragm goes into spasm, stops working at full strength, and as a result, blood starts to pool in your legs. And that's the first step toward varicose veins. Very few people know about this. But breathing, of course, isn't the only thing. There's another factor, the intestines. And when they're full, especially if you're also constipated, they start to mechanically compress the blood vessels in the pelvis and hips. With bloating, spasms, and disrupted peristalsis, venous outflow slows down even more. And this is where the veins take a double hit. Imagine this: poor breathing plus an overloaded intestine. Here is a simple but powerful exercise that will immediately relieve the diaphragm and pelvic organs, improve bowel function, and stimulate venous return. Let me explain how to do it. Lie on your back, knees bent, feet flat on the floor. Place your palms on your abdomen just above your navel. Take a slow, deep breath in through your nose. Your belly rises upward. As you exhale through your mouth, gently press your palms down and slightly inward, as if you're helping the air to leave. Inhale again, belly rises. Exhale, gentle pressing. Do 12 breathing cycles, slowly and without straining. This exercise is not for your abs and not for strength. The goal here is gentle influence on the diaphragm and abdominal organs. This kind of massage improves blood and lymph flow in the area of the liver, intestines, and kidneys, which means it relieves the veins in your legs. Also, at the first stage of varicose veins, one of the symptoms is spider veins on the leg. You've probably seen these thin red or purple webs on the skin. Most often, they appear on the legs, closer to the knees or ankles. This is a very important marker that should not be ignored. Spider veins are dilated subcutaneous capillaries, small blood vessels. They appear when the venous system is already overloaded and the small vessels can't handle the pressure. This is exactly how varicose veins begin. It's important to understand that spider veins are not a late stage, but actually the very beginning. Spider veins are a sign of an impending problem that is just starting. The varicose veins themselves may not yet be visible to the eye, but congestion is already forming inside. The pressure in the veins increases, and the valves start to malfunction. Now I'll tell you about 3 remedies for spider veins that have long been used by both patients and doctors. They're simple, natural, and they really work. You can use them at home. The first is kalanchoe tincture. It's one of the most well-known remedies. It's easy to make. Chop up fresh leaves, pour water over them in a 1-to-1 ratio, and let it steep for 7 to 10 days in a dark place. Apply to problem areas with circular motions every night for about 2 to 3 weeks. The effect will be very gentle, but long-lasting. It improves capillary tone and reduces swelling. The second remedy is a vinegar lotion or apple cider vinegar. It's important to use only natural apple cider vinegar with no additives. You need to dilute it with water in a 1-to-1 ratio. Wipe your legs with it in the morning and evening. You could also use it as a compress for 15 to 20 minutes. This lotion improves venous outflow and reduces burning and heaviness in the legs. Be careful. If you have sensitive skin, test your reaction first. And the third remedy is a tincture of nettle and hawthorn. Nettle stimulates metabolism and slightly thins the blood. Hawthorn strengthens the vascular walls. Take the tincture 1 teaspoon twice a day after meals for a course of 3 to 4 weeks. The main thing is to stick to the recommended dosage and always consult your doctor, especially if you have low blood pressure. Let me know in the comments. Have you tried any of these remedies? Did you notice any changes? It's really important to take care of your blood vessels because varicose veins and vascular damage, if left untreated, can eventually lead to trophic ulcers. And you know what that is. So what should you do to avoid moving to the next stage? Wear properly fitted compression stockings. Move more. Every evening, raise your legs above heart level for at least 10 minutes. And it's very important, don't ignore the condition of the skin on your legs. For example, dryness and cracks open the door to infection. Treat even minor scratches and insect bites. Use a moisturizing cream after showering. Don't wear socks with tight elastic bands. They disrupt blood flow. All of this might seem like little things to many people, but it's exactly these things that protect you from serious complications. And one more thing, did you know that the lumbar region is also an area where a large number of nerves from the pelvis and lower limbs pass through? And if there are pinched nerves, tension, or inflammation in that area, all of it affects the veins of the pelvis, lymphatic drainage, and the function of the venous valves. Imagine if your back is tense, it's like a belt squeezing the entire upper part and dividing your body into top and bottom, and the blood simply can't circulate properly. If you've noticed heaviness in your legs, spider veins, pain in your lower back or pelvic area, nighttime cramps, or numbness in your legs, all of this could be varicose veins, which can also be related to impaired venous outflow due to a lumbar blockage. So how can you help your veins without even getting out of bed? You might not believe it, but even lying down you can get your blood flowing and improve the condition of your veins. The first exercise is called lying scissors. Lie on your back, arms at your sides. Lift your legs 30 to 40 degrees off the bed and start gently crossing your legs as if you're cutting the air with scissors. Do 20 crossings, rest, and repeat once more. It might seem like a simple exercise, but it activates the inner thigh. It works the deep muscles and kind of pushes blood up from the veins. Second exercise, foot circles. Stay lying on your back. Lift one leg at a 45-degree angle. Rotate your foot. 10 times clockwise, 10 times counterclockwise. Repeat the same thing with the other leg. These micro movements wake up your calf muscle, which is your second blood pump after the heart. Third exercise, stretching figure 8. Lying on your back, knees bent, feet on the bed. Start drawing a figure 8 with your pelvis, first right and left, then forward and back. Move gently, as if you're drawing the infinity symbol. This exercise improves the mobility of your sacrum and pelvis, boosts venous return, and helps relieve nighttime tension in your lower back. Be sure to share this video with your loved ones so the problem of varicose veins passes them by. This was Dr. Dlin with you. See you in the next videos.